Just 3 weeks into the month of July, July has already seen more new COVID cases than we had in all of June here in Arizona.
So we could really be looking at our first significant spike since December. Spencer Blake has been talking with health experts. Joins us live in the newsroom. What's next, Spencer?
Well, in a way, it's a lot of the same recommendations. Get vaccinated. But there are some things you could do to stop the spread that maybe you haven't been doing for a few months now.
The COVID-19 pandemic is now mostly a pandemic among the unvaccinated.
Things are starting to change again in the context of COVID-19.
97% of COVID hospitalizations in the U.S. right now are among the unvaccinated, as are 99% of COVID deaths. Dr. Joshua LeBaire, executive director of ASU's Biodesign Institute, says you don't even need to be close to someone for very long anymore to contract the Delta strain.
This is not a time to participate in crowded events. I would avoid crowds right now.
He says anything to get more people vaccinated, especially young adults in a college setting, would help the public. But vaccine mandates are not allowed at state universities. We asked the governor's office about what policies might change if the surge continues. A spokesperson says they don't want to speculate because the virus is so unpredictable. But they pointed us to Dr. Kara Christ's repeated encouragement for everyone to get vaccinated. She also shed light on additional measures her 3 school kids are taking, since 2 of them are too young to get the vaccine.
They start school today and they will be wearing masks. I don't want them getting COVID. I don't want them bringing COVID home to me.
There is one piece of good news among the spike.
Because a lot of the population has been vaccinated, there's less likelihood of overwhelming the medical system.
LeBaire says a lot of people have decided they're done with the pandemic, but the virus and its mutations beg to differ.
Learned today about a still unpublished study that appears to show COVID may get into people's brains. LeBaire says that would explain, the brain fog and depression that some COVID patients report. But again, that study is still undergoing peer scientific review. Live in the newsroom tonight, Spencer Blake for Arizona's Family.